In 2021, there were an estimated 247 million cases of malaria and 619,000 deaths worldwide. 95% of these cases were in the WHO African region, particularly among children in rural areas. While over 30 mosquito species contribute to malaria transmission worldwide, in Africa, most malaria has been transmitted by just 3 or 4 species. Their different behaviors and habitats have been well studied. Enter Anopheles stephensi, a new threat to malaria in Africa. This mosquito species has historically been one of the main malaria vectors in South Asia and the Arabian Peninsula. But in 2012, it was found for the first time on the African continent in Djibouti. Since then, Anopheles stephensi has moved even further. As of early 2023, it has also been detected in Ethiopia, Sudan, Somalia, Nigeria, Yemen, Kenya, and Ghana. Anopheles stephensi is notoriously hard to control. Unlike the other main malaria vectors in Africa, this species thrives in urban settings. It inhabits artificial water storage containers such as wells and tanks. It feeds on different animals, mainly cattle and goats, but also people. It is also a highly effective transmitter of the 2 main malaria parasites in Africa. Added to this, Anopheles stephensi in Africa have been found to be resistant to several of the insecticides typically used for malaria control. The impact of this vector species on the current and future malaria burden is not yet clear, but increases in malaria cases in areas where the species has spread is concerning. In response to this threat, the World Health Organization has launched an initiative to stop the spread of Anopheles stephensi in Africa. It uses a 5-pronged approach, which includes increasing collaboration, strengthening surveillance, improving information exchange, developing guidance, and prioritizing research. But what practical steps can countries take to control the spread of Anopheles stephensi? First, enhance surveillance for vectors in urban and peri-urban areas. This will show where the species is, its impact on malaria transmission, and the potential impact of vector control measures. To facilitate this, surveillance data is mapped on the WHO Malaria Threats Map. Second, undertake vector control. While more research is needed on the impact of interventions on Anopheles stephensi and malaria in Africa, options available now include introducing insecticides or larva-eating fish into their main water habitats, and using insecticide-treated nets and indoor residual sprays against adult Anopheles stephensi. Research to develop and evaluate new tools against this vector species is also urgently needed. Third, as urbanization accelerates, cities should be expanded in a considered and holistic way. City dwellers must have access to piped water, better drainage, a cleaner environment, and good healthcare. This will require health departments to work with other sectors. Importantly, water towers, tanks, cisterns, and other water storage containers must be mosquito-proofed. This includes adding lids or screens to stop mosquito entry. House windows and doors should also be screened. To support countries in this work, WHO released a global framework for the response to malaria in urban areas and launched a global arbovirus initiative. Anopheles stephensi is a serious threat to global health, a threat that requires immediate collective action. Working together, we need to enhance surveillance, implement and evaluate vector control, and ensure holistic urban development. Only by doing so will we stand a chance of controlling the spread of Anopheles stephensi and mitigating the effect this species may have on malaria in Africa and elsewhere.